about falls in older adults. But honestly, I had no idea just how big of a public health problem this was until I dove into the numbers. Did you know that falls are actually the leading cause of accidental death for people over 75? That's staggering.
And it gets even more worrying when you realize how many older adults are affected. Around 1 in 3 people over 60 will fall at least once a year, and almost half of those over 65 have experienced a fall at some point. What's really tough is that many will fall again within a year, so it's rarely just a one-time issue.
When I think about my own family, my grandma has fallen twice this year alone. It really hits home. Beyond just the physical injuries, the emotional impact is massive. There's this lingering fear of falling again, and that can lead to people limiting their activities, which actually makes things worse.
Absolutely, and the consequences go way beyond a bruise or a broken bone. We're talking about loss of independence, new disabilities, even depression and social isolation. Plus, it creates a ripple effect. Families worry more, healthcare costs shoot up, and quality of life drops for everyone involved.
And as the world population ages, it's only going to become a bigger challenge. That actually reminds me understanding what causes these falls is crucial if we want to prevent them. Maybe we should break down some of the risk factors next?
That's a great pivot. What really surprised me is how complex the reasons behind falls can be. It's rarely just one thing, there's this tangled web of factors that come together. You've got biological changes like muscle weakness or balance issues, but also environmental risks like wobbly carpets or poor lighting.
And you can't forget behavioral stuff, right? Things like risky footwear, taking the wrong medication, or even just rushing to answer the phone. Then there's social factors. If someone lives alone or has limited support, they might take more risks or just have fewer people around to notice hazards.
Exactly. The Morse classification breaks it down even further. Some falls are accidental, like slipping on a wet floor, but others are expected because someone already has clear risk factors. That's why prevention isn't just about don't trip, it's about assessing and addressing all these different elements.
Funny enough, even though we're talking about prevention, you can't really do anything until you know who's at risk. So figuring out how to actually assess fall risk is the next real step.
Right, and this is where things get technical. There's a ton of different scales out there, like the Morse Falls scale, the Stratify tool, and the Berg balance test, just to name a few. Each one looks at different risk factors, from physical ability to mental status.
But I heard a lot of these tools have their limitations. For example, many aren't sensitive enough or might miss key risk factors that aren't obvious. Plus, falls are so multifactorial that one tool alone can't capture everything going on for a particular person.
Exactly. That's why the latest guidelines recommend a sort of layered approach. Start with some key questions, like, have you fallen in the past year? And then dig deeper if the answer is yes. There's even an algorithm for risk stratification, so you can decide whether someone needs a basic education program or a full-blown multifactorial intervention.
And documenting falls properly is such an underrated part of this. Not just who fell, but when, where, how, what they were doing, and what happened afterwards. That info is gold when it comes to preventing future falls.
Actually, documentation can reveal patterns a certain time of day, a particular room, or maybe a type of activity that keeps cropping up. That way, prevention efforts can be laser-focused instead of just general advice.
So assessment is only half the battle. Once you know the risks, the next big question is, what can we actually do to prevent these falls? Let's get into some of the prevention strategies.
I love this part, because it's all about teamwork and creative solutions. Preventing falls isn't just about telling people to be careful, it's tailoring interventions to each person's risk level and pulling in everyone from family caregivers to physical therapists.
And prevention can look totally different depending on the situation. For someone with low risk, it might be as simple as exercise programs and tips about safe footwear. But for high-risk folks, you're talking home modifications, medication reviews, strength and balance training, even vision checks.
Yeah, and one thing that stands out is how education plays a key role not just for the person at risk, but for their caregivers and the whole healthcare team. Hospitals are even rolling out structured prevention protocols, but those need updating as evidence changes.
Of course, none of this works without strong team leadership and communication. When healthcare teams are trained to spot risks and work together, the results are way better. Have you seen any real-world examples of this in action?
Actually, yes. Team-based learning has been a game changer for training professionals. Instead of just lectures, teams work through clinical cases like, say, an 87-year-old woman recovering from a hip fracture, or a man who's never fallen but is worried about it.
That's hands-on and forces teams to think through fall risk tools, choose interventions, and discuss options in context much more dynamic than memorizing protocols. Plus, sharing and reflecting on team behaviors, like with the scale of practices and behaviors, helps everyone see where they can improve.
What makes this approach really effective is the feedback and peer assessment. It's amazing how much you learn when you see different teams tackle the same problem with different perspectives.
And ultimately, whether you're in a hospital, a nursing home, or working in the community, it all comes down to collaboration because preventing falls isn't a solo job. Thanks for sharing these insights. I think our listeners are going to see falls in a whole new light now.